Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Timed Up and Go test assesses an individual's mobility, balance, walking ability, and risk of falls. It measures the time taken to rise from a seated position, walk a short distance, turn, and return to the chair. The main purpose is to evaluate functional mobility in patients with neurological disorders, musculoskeletal impairments, or age-related decline. The test assists in identifying gait abnormalities and balance deficits. It is commonly used in clinical settings to monitor progress and guide rehabilitation strategies. The Timed Up and Go test is indicated primarily for older adults and patients with mobility impairments or balance deficits. It is frequently used in populations with neurological conditions such as stroke, Parkinson's disease, and multiple sclerosis. The test is valuable in assessing fall risk in community-dwelling elderly individuals and in rehabilitation settings to monitor functional mobility changes. It provides objective data on gait speed, balance, and functional ability, facilitating clinical decision-making in fall prevention and physical therapy planning. Studies demonstrate its reliability and validity in these populations, making it a widely accepted tool for mobility assessment. The Timed Up and Go test consists of a single task designed to assess basic functional mobility and balance. The patient begins seated in a standard chair with armrests. The examiner instructs the patient to stand up, walk a distance of 3 meters at a comfortable and safe pace, turn around, walk back to the chair, and sit down. Timing starts on the command "Go" and stops when the patient is seated again. The response format is a continuous measure recorded in seconds using a stopwatch. A time of less than 10 seconds indicates normal mobility. Times ranging from 10 to 20 seconds suggest the patient may have some mobility limitations, but is mostly independent. Times exceeding 20 seconds signify significant mobility impairment and increased fall risk. Reference values can vary by age group. For example, individuals aged 80 to 89 typically complete the test in approximately 11.8 seconds, with a standard deviation of 3.7 seconds. The test does not include multiple items or questions, but focuses solely on the timed performance of the task. The sensitivity of the Timed Up and Go test ranges from approximately 75% to 90% in identifying individuals at risk of falls. Sensitivity measures the test's ability to correctly identify those who have the condition, in this case, a high fall risk. A sensitivity of 80% means that the test correctly detects 80% of true fallers, missing 20% who are at risk. Specificity for the Timed Up and Go test varies widely, but is often reported between 50% and 85%. Specificity refers to the test's ability to correctly identify those without the condition. For example, a specificity of 70% indicates that 70% of individuals who are not at fall risk are correctly classified, while 30% may be incorrectly labeled as at risk. In clinical practice, high sensitivity is crucial to minimize missed diagnoses of fall risk, whereas specificity helps avoid unnecessary interventions in those who are not at risk. The Timed Up and Go test was originally developed in 1991 by Podsiadlo and Richardson as a simple and quick assessment of mobility and balance in older adults. Since its inception, numerous studies have validated the test's reliability and clinical utility across diverse populations. Test-retest reliability has been consistently demonstrated with intra-class correlation coefficients ranging from 0.87 to 0.95, indicating excellent repeatability. Concurrent validity is supported by significant correlations with established balance and mobility measures, such as the Berg Balance Scale and gait speed, with correlation coefficients typically above 0.7. Predictive validity has also been documented, showing the test's efficacy in forecasting fall risk among community-dwelling elderly individuals, wherein times exceeding 13.5 seconds have been associated with increased fall incidence. Furthermore, the Timed Up and Go test has been validated for use in neurological conditions, including stroke, Parkinson's disease, and multiple sclerosis, reinforcing its broad applicability. These validation studies collectively affirm the test's status as a robust and clinically relevant tool for functional mobility assessment. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.